also known as Elizabeth. I just want to say thank you for everyone. Please, when we start this program, please share, click like. And on my today's program, we're going to be discussing substance misused. And I've got a professional, I've got one of the NHS director on the show. Please join me to welcome my guest today, Carol White. Can you please introduce yourself to the audience, Carol?
Good evening, Labarka, and good evening to your Health Matters group. While I can't see you, hopefully some of what I say might be helpful and I can answer some of your questions. I'm Carol White and I'm currently the Integrated Care Director in Havering, which is a borough of London, and where I work for a trust called North East London Foundation Trust. I'm also sometimes responsible for lots of transformation work across some of the London boroughs, so it's very nice to be here.
Thank you so much. So, like I said to you, I've got a big catfish. That's actually a really big one. Thank you so much, Carol, for agreeing to do this. I really appreciate. So, basically, we have quite a lot of people sending an email to say, can we treat substance misuse? Some people were talking about some cannabis, some people were talking about some other medication, and I thought, you know what? I've got one of my bosses on the that is actually a specialist in that field. So, when we say substance misuse, Carol, what do we mean?
Okay, that's a helpful starting point. And I think substance misuse is quite a subjective thing that people can sometimes talk about. And when I say subjective, my opinion, somebody else's opinion can be slightly different on what constitutes a problem. So what's also always very helpful with this is to actually think about some of the clinical diagnoses around this. So you will know lots of people in your life who may or may not use substance. And when we talk about substances, it's really anything that you can take, whether you ingest it, sniff it, smoke it, drink it, or even breathe it in, that potentially changes how you perceive the world and how your body reacts. So we call that physiologically reacting. So you could take a substance that makes your heart go faster or calms your heart down. So anything that also does that and acts on changing how your brain perceives the world and how it communicates internally is what we call a psychoactive substance. And that's probably what most people are talking about when they think of substance misuse. So, you know, people commonly talk about cannabis, alcohol. Some of the less talked about ones are drugs called GHB. So there's a whole range of drugs, all of which are considered to be psychoactive in different ways. But when we start to think about substance misuse, and again, some people will use the term substance misuse, some will call it dependency, some will call it recreational, but there's what I would always describe to anybody worried about substances is a range of issues. So you will have people that, you know, that don't take anything psychoactive at all. So they might stick completely to herbal tea, they don't smoke, they don't drink, and they never take anything as we would call an illicit substance. And illicit means it's illegal, it's somehow bought on the black market. Whereas a legal drug would be alcohol, caffeine, chocolate, because they also can change how your brain reacts. So there's different things that are both legal and illegal. And so you will have people that don't use any of those at all. Then you may have someone that's what we call a recreational substance user. So it's someone who may have a drink at a wedding or may have a drink once a week when they go out, but it's not a problem for them. You know, they stick to kind of healthy guidelines, but you know, they enjoy using that substance when they want to, and so they kind of not, they wouldn't describe that they've got a problem with it. And then the next level of substance use is where someone starts to feel that they have a problem, and sometimes they might understand that before people around them, and sometimes people around them may understand it before they do, and that's when it starts to have what we would call negative impacts on their life and how they see the world. And problematic substance use can be both psychologically problematic or physically. So you can have people that may be drinking too much, as a good example, and psychologically it's having an impact. Their world is gradually becoming more and more focused around drinking, but physically they wouldn't be one of those people that you think of as a traditional alcoholic who's waking up and being unwell because they need a drink, and that's when we get to the really high level of dependency. But you can start to get problems with all sorts of substances before you become physically dependent. So does that answer your question for now?
Yes, in fact, you've actually gone to the next question. I was
Oh,
really enjoying it. I was really enjoying it. Thank you so much, Carol. So you mentioned about some being physical and some being psychological, and obviously you talked about some actually like those that are prescribed. And so can we actually state and clarify at what point will it be a problem? At what quantity? Because you talked about, so then can we list the kind of drugs we're talking about?
okay. So, and again, a lot of this, what often we want as human beings is we want a very clear answer. We want, if I take this much every day, then A, B, C, D, and E is going to happen. And sadly, as human beings, we're all vastly different. So often when we talk about substance use, we have to talk about averages, possibilities. Hang on, my camera has just gone off.
That's right.
Can you still see me? My cat's decided to interfere. Like
Okay.
that. Hang on a sec.
That's right. Take your
Yes, I
time.
may have a highfalutin title.
Yeah, you're back.
Um, hello. So I think what's really important is sometimes when we think about substance use in particular, and also mental health, that everybody is very different as a person and how we perceive the world. So when we talk about when is it a problem for some people versus others, it can be very individual. So when someone um, may be drinking a certain amount a day, but it's not perceived as a problem for them at that time. Now, other people may perceive it as a problem. And what's the reason why I say that is because often when we're working with people around substance use, we have to understand what their view of that is in order to help them the most. Because if we just assume things, we don't tend to help them. So, so that said, so often in history we have come up with lots of very clever medications for all sorts of issues, and subsequently we have found out that those medications often have a side effect. So if we think about morphine is a really good example. It's got an amazing use. It's based on an opiate, and opiates come from the poppy seed, and they are a derivative of something completely natural and synthesized into making different painkillers. So they start with morphine. There's a medication called Oromorph, and then when you buy it illicitly, it's mixed with things and it's called heroin. But they all come from the same type of chemical structure. Now, latterly, we then discovered that unfortunately, morphine can create physiological and physical dependency. So, good reason to take morphine, but if actually you're on it for a short period of time, at some point you've got to stop. We have to be mindful of that. So there are lots of medications that we may prescribe that we actually have to be aware that they can cause dependency. And in doing so, as clinicians and practitioners, we need to be careful when we prescribe, so we're conscious of that. So, for instance, there are some tablets that you can buy over the counter without even a prescription, and they will have an advice that says, don't take for more than 3 days if you do go and see your doctor. And that's because there is a risk that that medication could become dependency forming. And I guess what happens is some of those drugs will get bought on the street illicitly because there is a market for anything that people may get dependent on, or that may cause a pleasurable effect. And then there are other medications that are purely illicit, and there's no way that you can purchase them through a chemist or through a prescription. I sort of lost track of myself there. So remind me what you wanted me to answer, just so I can make sure I've
So
covered
you've
it.
actually, you've actually answered the question. So the question is actually, so at what point does it become an issue? So as at what quantity do we need to take for us to? And you've
Okay.
actually talked about how you've actually answered the question in terms of do we need to be conscious of the amounts, and that you even cited an example of actually the days they won't buy on the counter, and to say that the pharmacy would say take it for certain days, and obviously if you still need more, speak to your doctor. So yeah.
Yes, so I think it depends on, so just to give a bit more information on that. So because of the nature of dependency, psychological dependency will tend to come first with any substance. And that's what I would describe it in layman's terms is to basically your life starts to become focused on that substance. So an example would be someone who has been a recreational alcohol user most of their life. They don't think they've got a problem, but over a period of time, perhaps something's happened. They've been quite stressed. They've become more reliant on having a glass of wine or two, and their brain starts to think that life is difficult without that substance. So it starts to flip. So the substance is almost becoming part of the problem that they're trying to get away with. And we call that a shrinking of someone's world around the problem. And so they may find that they're getting up in the morning thinking, oh, I must make sure I pick up a bottle of wine on the way home. And that's what we call shrinking. So they're starting to plan their way of coping with life around that substance. Now, what's a really good example is smoking. And often what comes with substance misuse is often a layer of morality. So we associate some substances as much better, some much worse, depending on our culture, our family history, lots of different dynamics. And smoking is one that in many cultures is still very, very acceptable. But what you'll find is people adapting their life around smoking. So they may, if they live in the UK, which is frequently very cold, find that they go outside in the cold weather, which is kind of the complete opposite of a sensible decision for many people, to go and have a cigarette break, because some part of that routine and that behaviour is comforting. And so what you see is this kind of shrinking around the substance of choice, and it becoming more and more the focus of your life, if that explains it.
Yeah, very well. Thank you so much for that. So, at what point can you combine? We're not actually talking about. You actually made it very clear in terms of the prescribed and acceptable things that people should take, and they should be cautious of going by the prescription, and if they're buying on the counter, to make sure they're not actually exceeding the dates the pharmacy is giving to them. But in terms of the substance like cannabis. So what is it that is not ideal to combine? And what's the danger if people do combine this drug?
So generally, medications have a sort of generic way of acting on the brain. So we call some drugs stimulants and some depressants. So probably they have kind of different risks associated with them. So a stimulant drug, so a good example of that is cocaine or amphetamines, betel nut, cat, nicotine, caffeine. They're a sort of range of substances that basically, when they go into your body, they will cause physiological changes like an increased pulse rate, an increased heart rhythm, increased blood pressure because it's pumping much quicker around your body. They are likely to cause some level of dehydration because everything's moving much quicker, and some level of heat. So we call that the kind of stimulant group of medication. So if you're someone who has some underlying health problems, and you've got some possibly a history of issues, and you take lots of stimulants, you're putting pressure on your heart. So if you were to take stimulants together, then that is a risk that actually you're what we would call augmenting the risk. And augmenting is a very nice technical term that's a bit like putting a subwoofer in your car. When your car comes with its normal speakers, it has a certain volume, and your doors can cope with it and they don't reverberate too loudly. When you put that big subwoofer in it augments all of the sound and makes the bass really heavy. And that's kind of what stimulants have a risk of doing with any of your underlying medications that might be impacting on your health. The difference with depressants is kind of what it says on the tin. Depressants they start to dampen down your body. So they'll slow your heart rate, they'll slow your respiratory rate, they will kind of dampen down speeding neurotransmission in your brain. So the big risk of depressants is if you take them in too much. Not even with any other medication, they can cause cardiac arrest and they can cause respiratory failure. If you take them with other medications, again, there is an increased risk that they can do that. So particularly, sadly, a lot of people will potentially take an illicit substance with alcohol. And alcohol is a very big depressant on its own. So alcohol is a really interesting drug because people think that alcohol is a stimulant, because people tend to have a drink and then they get quite happy and then they join the party and they start dancing and they stop being so shy. Whereas actually, after about the first couple of drinks, what alcohol does is it actually acts as a depressant.
Okay.
And there is a common phrase that's often used, which is crying in your beer, and that's because the depressants sort of taking on of alcohol within your body starts to make everything more labile in your mood, which means you're more likely to cry or be sad or be angry, and it changes people's impulsive behaviours. And long-term use of alcohol is really associated with higher levels of anxiety and low mood, and that becomes part of the problem, that you have a drink because you feel those things, but actually longer term it actually makes those things worse. So there's almost, I guess, with stimulants and depressants, there are short-term problematic risks, and then there are moderate to longer term risks when you keep using them ongoing.
Oh, thank you so much. That is actually well explained. So we're going to look at the statistic in terms of the death rates. Do you have any idea of any death rate that is actually related to substance misuse?
Yeah, if you just bear with, I actually pulled some up just for information.
Good.
Just find the right bit of information. So
Okay.
I guess importantly, when we look at the impact of substance use, we look at a range of factors. So we would look at the impact of substance misuse on death rate potentially, and that might be intentional or unintentional. The impact of those substances in terms of hospital admissions, and the impact on people's mental health is also something to really consider.
Yeah.
So what we absolutely know is that substance misuse is associated with probably 92,000 admissions to hospital in one quarter of a year. Now that can be from a range of different substances, but predominantly in the UK at the moment, alcohol is a very strong factor in that. And sometimes it's difficult to look at substance misuse and get exact details, because often the person won't necessarily present to hospital with, I've got a problem. What they will present with is a stomach problem or an accident. But actually, when you unpick the root cause, there will have been some kind of substance use behind that. There are also other high levels of admissions with accidental overdoses associated with opiates. There's a high level of accident and emergency admissions related to cocaine and stimulant use, where people start to experience overdosing on stimulants. And often you will get, when people have become dependent drug users, they may well be taking cocktails of heroin and cocaine, and that will often lead potentially to a move towards intravenous drug use at its worst, and there are all kinds of complications associated with that. But I think for the interest of your group, for most people, recreational to moderate substance use is probably where most people can have the biggest impact on their health. Often people that have become very dependent on a substance will need lots of professional help to support them and to become substance free. But the biggest impact we can have on hospital admissions and ill health is around moderating any substances that we use. You know, if you drink 25 cups of coffee every day, you're likely to experience some level of anxiety and palpitation, because coffee is a stimulant. So, you know, bearing in mind that, you know, drinking some non-coffee type drinks during the day might be helpful in that scenario. So it doesn't, I think often people think of substance use as a big extreme, where they sort of have a picture of someone destitute and, you know, they have a view of what a substance misuse problem looks like. But actually, if we take it to the other polar end, most of us can impact on our health just by being mindful about the impact of substances.
That's actually a valid point, Carol. Thank you so much. Because obviously, some people don't take alcohol, but they do love their coffee. And obviously, they do love their cappuccino. They do love their latte, you know. And sometimes, especially professionals, they can't have up to like 7-8 cups within, you know, the work frame of 9 to 5, you know. And I think you can hear now to say we need to kind of mix it up, maybe try some decaf, and obviously be conscious. So somebody is sending a text message on the platform just now to say, if somebody is drinking, obviously alcohol, in terms of alcohol, and at what point would they have to be conscious, because they love drinking, they enjoy it, and obviously they are actually experiencing what seems like anxiety, like you explained, like they have having all this, you know, feeling. Sometimes they don't feel like doing anything, sometimes they're really hyper, sometimes they're mad, you know. So they say, at what point, what are those symptoms they need to watch out for them to know it is actually becoming a problem?
Okay, so I mean, generally, the advice from the UK Public Health Department is that you should try and have at least 3 days per week not drinking, and the reason for that is that the liver is an incredibly amazing machine in our bodies, but it does need a bit of a break. And if you continually drink every day, your liver is basically under pressure. And so I guess that's one of the physiological beginnings of the impact of heavy alcohol consumption. And on average, a woman should drink between up to 3 units
3 units.
over the week generally. So it's a relatively small amount. And I think when you start to actually look at the amounts that people are supposed to be drinking, it is quite small. But I think we also need to work in the context of people have lives and they will have dips and peaks and troughs of stress and anxiety. And sometimes, the use of alcohol will be part of their social circle that's helping them deal with stress and anxiety. So my view around all of these things, and my view when I was working directly clinical, was to look at any substance use in the context of what's going on for someone, because nothing happens in isolation.
True.
So if someone is sort of beginning to rely upon alcohol and they're even asking the question, when is it too much? What I would suggest is there's probably something going on that you need to talk to somebody about, start to understand what that might be related to, and often there are some other things that might be causing anxiety that the person isn't able to perhaps negotiate and work through, and they're just using the alcohol as a support for that. Not always, but often there is a rationale, work related stress or some relationship difficult things going on. But I think we often talk about just beginning to move into a stage of exploring what that is about.
Okay.
And often that can be associated with feeling a bit uncomfortable. So when you think about something that you're doing and you're not sure if you're feeling that that's okay or not, that can leave you sometimes even more uncomfortable, because part of you is kind of acknowledging that you think you might need to change, but you may not be ready. And sometimes people might need a space to talk about that, just to move into a period of being able to exact some change around that. And that's what services are there for. They're there to have the conversation and give you hints and helps. So, in terms of when would you know, I would say if you're asking yourself, have I got an issue, then you probably think you may have something to worry about, because your brain's thinking about it. So in some ways it doesn't matter whether you tell me you're drinking every day or just once every 7 days. If you're worried about it, then something about that is making you anxious, and it's probably worth just having a think about that with a chat with somebody.
Thank you so much. I think that's actually really the major issue. So as you can hear, I don't know if you're online on the radio or you're on the Facebook. So what Carrie's just explained to say, there must be an issue around why you're drinking. So we don't just want you to actually look at the drinking as an issue. So get support for the major, what is actually the main problem that is causing you to drink all the time. So because obviously, so we're going to open the line now, so people can call in to ask Carol questions. So the number, can one of the admin on the platform please put the number, is 079 353 18757. So you can call in to ask your question, you can call in to chip in any information, any supports. So this is the time, and you can call in. So if you actually want to call in, and you can call in on the second number, 078 7016 7525. So whichever one is actually convenient. So we'll carry on talking and wait for calls. So as soon as the call in, we'll stop and pick the call and we'll respond. So we were actually, I'm going to take you back actually to, you did mention about people having 3 units and obviously units of drink weekly, which I know that's not possible, to be honest, for people that actually I know that they drink. And you did mention to say part of recommendation according to the is it World Health Organization, did you say, or UK NHS, 3 days without
UK.
Yeah, 3 days without drinking. So, and you do, I think I need you to actually stress more in terms of the liver, the damage, whatsoever all these things is doing to our physical health. And then obviously while we're at that, we can wait for people to call in. So I will just leave you to carry on to talk, Carol. So I think we have a call already. So we'll pick that. Yeah. Hello? Can you just increase the volume, please? Hold on. We're going to increase the volume. Hello?
Hello.
So just we're going to increase the volume. Hello?
Hello. Can you
Yeah.
hear me now? Is it
Yeah, I
better?
can hear you now. So,
Okay. Good evening, everyone. Good evening, Carol. Good evening, Elizabeth. How are you all today?
yeah, just,
Um,
yeah.
yeah, and I would like to say thank you, Carol, for coming over. I just have some. Okay, this is talking about substance misuse. Well, substance abuse or substance misuse. There are. I just want to know how could family members also be supported. For example, there is a family member of family friend kind of like he unfortunately he went down the spiral of drinking and abusing to the extent that he got to a stage that he had to leave the property, his own home with his children. He had young children, and it became way too much. So he was admitted to hospital due to several things. He even had a social work, but because he is an adult and he has capacity, following the Mental Health Act, he had capacity. So, and he couldn't be forced, to retain and continue with the support. But the issue is, I see how the system is trying or was trying and still trying to support these adults. But how can you also support the family members, especially the children, because they've seen the dad used to be the perfect example and religious and well-to-do, well-mannered, very kind. Unfortunately, he just went from being the perfect dad to where he is now. His wife is struggling immensely and she's unable to cope and doesn't know how to explain to the children because the children are under 10 as well. A 10 and I think a 7 years old. So, yeah, my question is, how do you support family members? I'm sorry for rambling.
That's
No,
right.
not at all, not at
That's
all.
right.
And that's I mean, I think that's probably an area where so many people would like to know what the perfect answer is. And I think just before I go on to answer that, I just need to clarify the units per week. It should be try to have 3 days of rest off alcohol every week to sort of give your drinking days a rest, but also no more than 14 units in a week. Sorry, I should have
Same.
made that clearer.
14, thank you.
Okay.
But but coming to the caller's question, gosh, if I only had the perfect answer of how to help families, I think there are multiple ways. If you are experiencing someone within your own family who you're worried about, there are organisations called Al-Anon and Cafcas that you can talk to, and often what is for me, in my experience, and it may not be the same for everybody else, it's opening the door to have a conversation is a starting point. Now, that doesn't mean that it you know completes that journey for every person you're worried about, but I think you are more likely to get a successful outcome if you open up the door and engage in a conversation. So really good examples of that from the evidence is that when people do a month of not drinking, they're more likely to start having questions about wanting to perhaps drink less because they've had a period of understanding what not drinking does. So it may not be successful in every case, but certainly seeking help, having a conversation, going to the help groups, understanding that you're not alone in these kind of experiences is really helpful and can provide a lot of support. The case you're describing,
With this issue, the husband now, if he doesn't drink, he gets violent. He gets not violent as in he get emotionally abusive.
Okay.
He gets emotionally abusive and he reacts. It's just like they've never most of the family friends and I've never seen him in such a way before. But the devil, because it is a demon that he's dealing with, and I think the demon at the moment is greater than what anyone could support him with, to the extent that most people are now detaching from it because most people feel like if they do that, maybe they're helping even his family as kind of his own parent. They were enablers before, but now they thought if they do, that might just, take him out of it and he might just but if he doesn't drink, it's got to the extent that if he doesn't drink, he could be nasty, break things, doesn't care about repercussion, the consequences, doesn't even care about the children. So she had to literally, the wife had to literally kick him out for the safety of the children. And even though she's trying to talk, I think the issue she's got about talking about it is shame as well, because the
Yeah.
stigma, because it is quite shameful, because, and I think she has, she feels like some people are blaming her because from a very perfect man, and they had a very, the beginning of the marriage was, but there's no perfect relationship, but he was blooming, he was really good, and then he just went the spark, it just went. So it's just, yeah, I do get it. If you're meant to give your liver a break, and I just want to know what other area of support, like maybe a charity organization that, or counseling, or whatever, that she could explore, and the family and the children could also explore. You
Of
did
course,
mention
what I can do is
Casson.
I can send some links through for sharing on the platform. But I think it, I guess when I'm hearing the issues that you're describing, certain questions are coming into my head clinically around how physically dependent this man might be on alcohol, what detoxification support he might be getting from a medication point of view. Because if there is a level of physical dependency, trying not to drink is actually dangerous. And we have to support people to stop drinking very carefully, because there
Quickly,
are
yeah.
all sorts of implications. So, and it may be, and I'm very happy to try and pick this case up offline and to make sure that appropriate support's being
It's given.
explored.
Oh, brilliant.
Um,
Oh, thank you.
be-
Yeah.
because I just
All right,
think
thank
it's very difficult to kind of generalize,
Everything.
do this in this case, because I don't know everything clinically.
Yeah.
But certainly there are some generic links of support we can put in place. I would only just say as well, I think it's a really difficult situation where you are an adult within a relationship and one of those partnerships is going through a dependency potentially. And there will be elements of that where the person will want to help, they'll have guilt, they'll have shame, all those things you've described. But there are some, I guess for me, some red lines of risks to children, risks of violence within the home, that they are not, you don't have violence as part of your dependency
No.
syndrome.
no,
So
no.
it's about what bits we accept and what bits we try and support with, and then where we draw those red lines. So I think happy to absolutely pick this up offline, and we'll see and make sure that we're trying to do everything we can for this case.
Okay.
All
So
right.
thank you.
Thank you,
Before you
Carol.
go,
Thank
caller,
you.
so
Listen.
you can actually send the information or how to reach you on info.health@yahoo.com. So info.healthmatters@yahoo.com. And I want to, before you go, I want to appreciate the caller, because this is the essence of the program, for you to be able to call anonymously, ask your question. We understand it must be hard for you. We have another caller, Carol. We'll come back to that. So, hello, you're welcome to your Health Matters program.
Hello, good evening. My name is Dare Joseph. Yeah, online, listen to your conversation. Can
Thank
I
you.
just contribute a little bit?
Yes,
Some,
please.
yeah, following the discussion, the other lady was talking about concern about the spouse or the partner. I think she needs some family work,
So
do some
before
family
you go,
work.
Derek, can you introduce yourself and your clinical background so people can understand who is talking and why they need to, why you're saying what you're saying, please?
Okay.
Because I think I know that voice.
Yes, I'm a substance misuse nurse and
That's it.
also nurse
Thank you.
prescriber in
Thank you.
substance misuse.
Thank you.
Uh, yeah, yeah. I really enjoy all what our host has been saying ever since. It's fantastic, and I agree with all what she has been saying. I just want to add to what the contribution that she had. I mean, that she gave to the lady, that the lady needs some family work for the children and the family to understand the consequence of the current drinking, and for that person in particular to know the risk that he is putting himself into. You know, yeah, that needs to be done. And also in terms of the abstinence of alcohol, I think this person needs to follow the pathway, maybe to be referred to the addiction service, so that for possible assessment, full assessment in whatever substances is having a problem with. Also, probably it could end up to be detox and rehab probably they could get the funding for that though. Yeah, for a detox and rehab. Although the motivation has to be very high before that funding can be agreed. So I think there's a pathway that that person needs to follow regarding that as well. I think there's a local drug service in each boroughs where the person can go to cry for help, and they can take it from there. You know, yeah, yeah. I
Thank you
think
so
so.
much. Thank you so much. So I
One
will
last
actually
question.
ask
I have a question for the host.
please I will actually please can you have put those information on the
Oh,
platform whenever you're free, please, so that
all
the
right.
individual can pick it up. So we've got so that the individual can pick it up after the what's it called, the program.
Program.
Yeah, and Kara is happy to follow up after the program as well, so that we can follow it through. Like I said, this is the essence of the program, and we'll make sure that even after whatever borough, we'll make search and ensure the wife is being supported. And maybe, just maybe, there are things happening around in the family with the man. You know that is I didn't remember to actually ask the caller before she dropped what ethnicity is this individual from. So because sometimes men struggle to share the feelings and emotion. So maybe talking to a professional or somebody outside might be, they might be comfortable to do that. I missed a call, and while you're on, can I please ask the caller to try calling back, please, just like in a minute's time. Thank you so much, Dari, for calling in to support. Thank you so much.
Yeah. Right.
Thank you. Bye. Thank you. So I'm going to pick the next call. Hello.
Hello.
Can you please reduce the volume of your TV or radio or phone, please?
Okay. Can you hear me now?
I can hear you now.
Okay, I just want to contribute to what has been said. Hello?
Go ahead, please.
Hold on 1 minute. Hello, can you hear me now?
Perfectly well, thank you.
Yeah, my name is Dr. Casson. I just want to contribute to what has just been said.
Okay.
I would like to thank Labake for bringing this matter up, and also Carol for giving a very fantastic talk. My name is Dr. Casson. I'm a psychiatrist.
Thank you.
It happened that I used to work in the drug and alcohol service
Thank you.
in East London. What I would just like to say is, you have to look at, there are so many dimensions to this, people getting addicted to alcohol, people getting addicted to drugs. And also you have to look at the complication of things. The most important thing, when you look at, alcohol has its own effect, drugs has its own effect. But, with drug, what comes to it is, when somebody is taking recreational drugs, they start slowly, and with time they get addicted to it. And what that happens is maybe they start with smoking, and they now actually went on to injecting. And when they started injecting, it comes with the own complication of STD, blood-borne viruses, and all stuff. And the danger is, for them to actually come off this drug. I know there are so many places where people go access in order to get help. But, I don't know, in the past, it used to be well known that people just, the GP refer people, and, they go there, they have proper channels to go into the system. But these days, you have to take it upon yourself to refer yourself. But the problem we have is people that are taking drug or alcohol don't see it as the problem. It is the people surrounding them that see it as a problem. So it becomes very difficult for them to access, to go and get help. And also, if you look at other, mental disorder, like maybe psychiatric problems, there are ways where you can actually take people into the hospital for them to be treated. But with alcohol, they can't, section them. You cannot use section to bring anybody into hospital to get treatment. So that is the difficulty in that aspect. And why do people go into drugs? So many factors, which Carol has mentioned. And people go to drugs due to, peer pressure, people, following, especially in schools, and, they don't actually know what they're doing. But by the time they take it once, they keep, going on, taking more and more. And sometimes where this is the head, which is at home, because the home is already dysfunctional anyway. So it becomes very difficult for the person taking job to actually open up to the parents. So which brings me to the fact that parents should be more closer to their parents, should know any changes in their behavior. Some at times some of them comes in home kind of with pinpoint face and sleeping too much and smelling of cannabis and everything. Parents should be able to know the signs. They should be able to kind of spot the difference in their behavior when they come in. That is for the parents or family or friends. They should be able to know, because people taking drugs or alcohol doesn't see it as a problem when they start. They see it as something that makes them high, and they continue on it, and they will refuse to actually go for help because nobody can force them. If somebody comes to my clinic with drug problem and he said he wants to leave, there's nothing I could do. I just have to leave the person to go. And also, I don't know, there are so many drug and alcohol services now, and I'm not sure about the funding from the government, whether this is being kind of let people know the danger of drugs. That's something that needs to be looked into. That is just my contribution anyway. It is actually a very good topic that everybody should know about drug and alcohol. It's something that is trending. Recently, some school kids, university students went out. It's all over the news, and in the papers they went out and they spiking their drinks. I think, if I'm correct, one of them actually lose their life, in this situation. So it is very important we know about drugs anyway. And know your friends, know the people you go out with, it's very important. That's my contribution.
Thank you so much, Dr. Casson. Thank you so much for that. Thank you so much. So, Kara, I'm going to take you back. I'm going to take you back to what we were saying in terms of the caller that we were dealing with. So, if the caller is still online, like I said, send your details, your email. You don't have to put it on the Facebook platform. Put your contact details on info.health@yahoo.com. info.healthmatters@yahoo.com. So if I get your details, I'll pass it across to Carol. Then we'll follow it through and make sure, we'll look deeply, like we said, to make sure the person is getting the right support. There's another call. We'll pick it up now. Hello, you're welcome to Health Matters program. Hello. Hello.
I have a question, and I don't know if it's okay for me to ask my question. I may be embarrassed, but so I don't want you to call my name.
That's right. That's right. Please go ahead. You don't have to introduce yourself. Please go ahead.
If since the lockdown, I don't get to see a lot of people. And I realize it's better off because drinking some bits of alcohol helps to sleep and stop the loneliness, So I'm just thinking, you keep talking about support. If someone is in the community, there's no support for lonely people. So it's only people with family and things like that. Since the lockdown, no one check on me, no one talk to me. Thanks to Facebook, I get to see a lot of you talking.
I think, caller, you describe probably the experience of a lot of people, not just in lockdown, but in general. And I think loneliness and not self-isolation, but being isolated is a really common thing, and it's something that in the modern world we probably talk not enough about. I think what's often described is that we connect more in the digital space but less in the physical space, and here I am talking to you all digitally, which is great because none of you would normally get to meet me, but there's something very tangible about being in a physical space with people. For a lot of people prefer that warmth, that comfort, and there's been a distance. COVID has made lots of things very difficult and really enhanced the experience of loneliness and anxiety for many people. I think what's interesting is a lot of the things that we would talk about if you were to come and see me clinically. What we would start to talk about is how can we engage you out of your house and with the community that's near and around you, and how can we help you to do that. So without knowing exactly where you live and your circumstances, again, there are some things that we do in Havering. So there's lots of groups that operate where you may get to meet people that you actually realise that there are lots of people around you experiencing the same thing, but you wouldn't necessarily go and talk to someone in Morrison's about how you're feeling, but actually there's probably up every aisle in Morrison's someone who's sitting there thinking, I've got nothing to do tonight, who am I going to talk to? So there's something around, often with mental health, and substance misuse is just another part of mental health. It's part of that way of being someone who experiences life, the ups and downs, the goods, the bads. Mental health's really hard to talk about, and yes, we're better at doing it on Facebook and putting inspirational quotes on Facebook, but that's not the same as sitting down with someone and going, do you know what, I'm really lonely, and sometimes when I'm lonely I don't do much in the evening, so therefore I don't sleep very well, and that makes me feel even lower the next day because I haven't slept very well, so I might have a drink sometimes to get me to sleep. So lots of the process of opening up about someone and how they feel starts to unpick some of the things they might be doing that probably aren't very good for them, but unless you actually go back and kind of explore why they're doing it, you won't ever be able to fix it. So I think I wouldn't say don't give up hope. There's lots of stuff out there that you can be plugged into. I think being open and honest and saying I am lonely is a good starting place, and people can then sort of work with you around that and see what feels comfortable, because you might be lonely, but that doesn't mean you're comfortable going and joining a gym or going to a social group. So it's really about testing out who you are and what might be something that solves some of that worry for you, and how can we get you there. And it's incremental for many people.
Oh, thank you so much, Carol. I think you've answered that perfectly well, because to start with, people are not the same. So what actually, if you want to unwind, what you kind of take pleasure might be different from what I will find interesting. So I think for that caller, I want to appreciate you calling, like Carol rightly said, that you've actually taken the first step, the bold step, to even acknowledge you're lonely. Because what is happening these days is that people don't talk about this problem. And it's a major issue, and that can lead to a huge, major problem. So, and loneliness is actually a major, serious issue. When someone is lonely for a long time, and she did say something that touched me, for people who don't have family. You see, some people have good family network support. And I think I'm going to use this platform. I think I can see almost like 380 something people online watching this program. I think this is a medium for you to check on yourselves, check on family, check on friends. We can all be busy. I know we are so busy, because what we don't seem to understand is that people will come out, put on makeup, look good, and still things are happening. If you check on them, and if you go to them, then they'll be able to open up. If you get closer to them, you'll be able to know what is happening. I think we need to look for how to kind of check within our circles, friends, family,
I think just to add to that, Labaka, I think often what we perceive as human beings is this view of the world and how we look at other people's worlds and how they look amazing potentially to us, particularly through the prism of Facebook. Not many people put on Facebook what a horrible day they've had. Often it's pictures going out, checking in somewhere, pictures of the family. So we can have almost a kind of false image of what our lives should be like. And if we're feeling quite down or low about our lives, Facebook can be a blessing and a curse all at the same time, because it somehow dangles a life that we feel we may not be getting. And there's something always for me is what is a sort of reasonable thing to aim for that will make you feel better. And it isn't always the thing that you're seeing on Facebook. It's the thing that might give you a bit more structure in the week, that just means one night a week you do something different, and that sustains you enough to get through week to week. It isn't about having this amazing group of friends or this really cool social life. So there's something about perspective and also making incremental goals and plans that are achievable, because otherwise you'll probably not make them, and then you'll feel even worse about yourself. So I think it's about kind of always just thinking about what do we think the little things we can do that might make you feel just a little bit better, and building on those bit by bit.
That's actually a good point as well. So like carousel, this is actually set target for yourself, do those little things, and obviously you will be fine. So because we are actually going to be rounding up soon, we might actually just we'll miss a call earlier on, and if the caller is actually still out there, you can call back. The number is still 079 353 18575. So I'm just going to quickly recap what we've said today in terms of substance misuse. So thank you so much, Carol, for coming on today's program. So Carol has actually been able to tell us what we meant by substance misuse in terms of we're going to pick that. Hello, welcome to Health Matters program.
Hello, good evening. Hi, thanks, Rebecca and Carol. I've been listening to your program and I'm really enjoying it. However, I just wanted to ask a quick question as a healthcare professional. If that's okay?
Sure, please go ahead.
Okay. My question to you is, I often deal with people who drink alcohol, and most of the time they wanted to stop drinking, and like Carol said before, that you need some time, but however you just don't stop because there are things that might go wrong. My main question here is, how often do people who want to stop drinking alcohol have access to medication for the withdrawal symptoms? So how fast can they have access in order to prevent admission? So that's my question. How do they do it? Will they be able to get it from the GP? Will they be able to get it from the rehab or any groups or call Anonymous, all those places? So I just wanted to know how fast they can get access to medication. Some people don't want to go into groups. They just want to deal with that at a short time, whereas they need long-term care. So I just wanted to know that, how to deal with that. That's my question for you.
Okay, I can try and answer that as much as possible. So I guess when we talk about detoxification, it's always helpful to think about planned treatment detoxification and then unplanned medical emergency management. And the reason why I separate those is that if someone is a physically dependent alcohol user, it is one of the few drugs where if you stop it suddenly, it is considered a medical emergency. So that, along with some tablets, benzodiazepines, barbiturates, those kind of medications, you cannot stop them suddenly because the body has become so physically dependent, it needs that substance. So in order to get someone off that substance safely, you have to do what's called a detoxification, which basically is a period of medical intervention, generally with a different substance to taper off and manage the symptoms. So the acute symptoms of alcohol withdrawal are vomiting, are tremors, are very bad headaches, it can be seizures. So these effectively are very dangerous and people can have serious complications with cardiac problems as well. And then there are much more alcohol serious related ones, but those are probably the main ones to watch out for. So if someone is drinking dependently and they wake up the next day and they go, right, I'm not going to drink, there is a risk that they could have seizures for up to 5 days potentially. Now, some of that potential gets worse the first 72 hours, but then it carries on. So we would normally medicate someone for up to 10 days with generally something called a benzodiazepine to help minimize the impact of the alcohol. The other thing that tends to happen with alcohol users is they don't generally eat very well, and when you start not drinking and go on a detox, you can have other impacts of the vitamin deficiencies that you haven't been receiving because of the alcohol use. So there's a number of complications that can happen, and for that reason, if someone attends an accident and emergency department or a primary care setting in what they consider to be alcohol withdrawals, it should be treated as a medical emergency. Now, that is to take care of the immediacy, the problem that's presenting that clinician in front of them, but I would never advocate doing that in a planned way. And the reason for that is we've got A&E departments that are very, very busy. Getting an unplanned detox for your alcohol use isn't going to actually treat you. It's just going to manage the symptoms for a day or 2 days until the medication runs out. Whereas I would advocate that if someone is even remotely thinking about reducing their alcohol, stopping, that they go and speak to an alcohol service or their local drug and alcohol service. And there is one in every borough. There has to be. It's part of the public health offer. And they start to have those discussions around the size and the issues that they have. And the reason why that's important is because for some people they can go on a self-reducing pattern of alcohol use and reduce that safely. For other people it would be incredibly dangerous. So I would always seek support around that agenda. If that clinician or the drug and alcohol service then believe that that person does need a detoxification, they will apply for a funding stream to get that person to detox. They then think they need what's called rehabilitation, which can be between 3 and 6 months. They will seek that funding, but that's in a planned way. And the reason why we talk about trying to do detoxification and rehab in a plan way, it's because it's what the person's prepared to engage in, and it's therefore going to be more successful. Now, there are patients who will be admitted to hospital, sometimes against their will on the Mental Health Act, who will be detoxified. And that can be a really helpful thing for that person. But if they don't have those kind of risks of being detained under the Mental Health Act, the most helpful route is to get it in a planned way through a drug and alcohol service. And again, those kind of services will be on the internet. You just need to put in local drug and alcohol team. There will be one in every borough of the country.
Oh, thank you so much, Carol. So, actually, that's going to be the last call. We missed a call, just now. And obviously, I wasn't going to call T because I needed that information as well. So, that's actually good to know. So, for today, we're going to call it a wrap for today. Thank you so much to all the viewers on the Facebook and to those on the radio that are listening. We really appreciate you. Thank you so much. And if you have any suggestion, any questions, any I think I'm gonna pick this one last call, and we're gonna call it a day. So this is the caller calling back. So, hello, welcome on your Ultimates program.
Yeah, good evening, Labake. Yes, this is a very interesting program. I'm a psychiatrist myself, and I just want to add to the program. Thank you to yourself and Carol. You've done a wonderful job.
Thank you.
And I think a lot of us have learned from the program today.
Thank you.
However, the issue I want to point out is that quite a lot of the time, when we see people who've been taking drugs, we kind of assume that all their problems are to do with drugs. There are some of them that have what we call comorbid illness. Mm-hmm. So they have maybe psychosis, they have schizophrenia, or bipolar, or some other mental health disorders. So in carrying out the assessment, we should be really careful in establishing whether they have any pre-existing mental health or mental disorder prior to using drugs, because in actual fact, some of them resort to drug taking as a result of distressing voices, mm-hmm. or maybe, the psychosis, paranoia they're going through, and all of that. So I just want to say that it's important that we need to be able to not kind of just whisk them away and say this is drug and alcohol, go to drug service, which also look whether there's any underlying mental illness that needs treatment on its own. Because as you all know, the mental health services is quite separate to drug and alcohol service. And occasionally these sort of things do get missed out, when they're pushed one way or the other. Yeah. So it's always, good for us to bear that in mind when we're assessing people with drug and alcohol issues, to see whether they have comorbid illness, and also to make the appropriate plan for them in getting or seeking help with their mental health as well as their drug or alcohol use. That's just what I want to say.
Thank you so much, Dr. Casson. Thank you so much. That's going to be actually all for today. I've actually exhausted my 1 hour. So thank you so much. A big thank you to all the audience. A big thank you to Carol for I know you're so busy, Carol, with this transformation happening. I really appreciate you coming on, sharing your knowledge and using your time to do this. Like I said to people, I don't have the money to pay my guests. She's actually my boss's boss. So so thank you so much. I really appreciate this. So
You're very welcome.
If you have any question, please go on your Earth Matters page. If you don't want people to see your question, put the question in the inbox on info.healthmatters@yahoo.com. You can put your question in there. It will be treated. We appreciate the fact that people like to keep their life private, and obviously we understand the law of policy and confidentiality, and obviously we're going to keep your issue. And after this show, you can actually put in messages in my inbox or anything. We'll respond to it. So normally I don't really talk about do any program before we go in December, but there is this new transformation happening within the NHS mental health settings. So you might likely to be seeing Carol back soon. Because
I'll have to work on my Christmas background.
Exactly. So a lot of people ask a lot of questions, and they're asking me we need somebody to come and talk to us. We need somebody outside work that'll be able to relate and ask free questions, and I'm looking into it. So till next month, look after yourself. Make sure the COVID-19 is still out there. Make sure you protect yourself. Keep on with the hand hygiene, and make sure you protect your family. Make sure you look after yourself. So thank you so much. Bye.